Welcome to a new episode of our weekly web series, Science in Context. The Vaccine Epidemiology Research Group developed a method to sequence polio from stool samples. I'm Sabine and joining me today is Dr. Alexander Schul. Alex, can you tell us a bit more about this new method?
This method we've been developing is for the rapid typing of poliovirus, and this has been developed as part of the global polio eradication effort. So our method targets a key element of the genome, rapidly gives that sequence, and that allows you to guide this response.
I understand this method reduces the time needed to sequence a sample dramatically. Why is this important?
This is important because the sooner we can identify the kind of poliovirus in a child's stool sample, the sooner we can respond with an appropriate immunisation campaign, be it the oral polio vaccine or the novel oral polio vaccine that's recently been released by the World Health Organization.
And your team has recently returned from the Democratic Republic of the Congo, working with a local laboratory. What were you doing there?
So we've been working with that team for about a year now. We originally trained them in this rapid sequencing method for poliovirus during the pandemic. So that was done remotely, and they've been doing excellently processing samples using that method for the last 6 months after that. They processed thousands of samples, and we recently visited them to build on that work, teaching them further methods to amplify and sequence larger chunks of the genome, so even doing whole genome sequences in one go in a single read. And that's a really useful skill for them to be able to do. It allows them to gather as much information about the virus as possible, and to do so within the country without having to ship samples abroad for typing or identification. It's also a really useful skill to have transferably. It can be applied to other pathogens, say future outbreaks or pandemics. These same skills can be used to type those organisms and do so very rapidly.
Thank you so much for your time.
You're welcome.